Humble beginnings. My story, my testimony.
My wonderful viewer, I know your blood is pumping. And I know you are also anxious when you are going to come back. We are back. I tell you here, there is a testimony. Really testimony that is really impacting. We have heard from Mom, and let's now go to Dr. George. Dr. George, we honor you and we salute you.
Thank you.
Thank you for allowing God to use you, even to help shape the destiny of Mom.
Yes.
Thank you. Welcome, Dr. George.
Asante.
Tell us again who you are, what do you do?
My name is Dr. George. In this profession, usually use our surnames. So sometimes you say Dr. George, it looks off.
Yeah.
But for the way I'm used to, I'm Dr. Njehi Akihara.
No pressure.
That's my mom. We are happy to be here today. Our journey has been one that is of a miracle. People talk about the American dream. I think we have a Jehia dream here today.
I tell you,
now,
very lively one.
As you heard, we had a farm. In the farm, I used to do open heart surgeries on frogs, on cows, and one time my my mom found me trying to do some funny things on cows, and anihurumia because this boy will go. You know, a cow is not like a goat. So we used to open up frogs, then we stitch the mark together.
Wow.
At the age of 8, my dad bought me a stethoscope, which looks like this, which I used to listen on anything that had a heartbeat. I would listen to chicken, I would listen to cows, I listen to dogs, everything that had a heartbeat, I had to listen to it.
Wow.
At the age of 8.
At the age of 8?
Yes. That time I was in class 2. So fast forward, that same stethoscope is what I used when I was doing my clinical officer's exam. That was in the year 2012. That's the time I did my COC. And that time, that's very, very stethoscope I was bought at the age of 8 is what I used. But what really confirmed that I'm going to really go into this field was the time I felt ill when I was in Form 2. And then when I was in Form 2, I was admitted. Before I was admitted, I was misdiagnosed with hepatitis. Just for us to get another second opinion, just to be told that it was pneumonia. You know, when you hear pneumonia, it's a bad disease. It's a disease that is known to kill patients who suffer from pneumonia. However, its diagnosis and treatment is very, now when you come on the side as a medic, it's a very straightforward thing. I remember the gentleman who saw me, the doctor who saw me, and recommended that I get admitted. By the following day, I could be able to breathe well, walk around well. Wow. And then that told me, now whatever he did, I want to know how it is done. And that's how the dream of becoming a doctor started. Now really got emphasized. You know, that time when you're playing with the stethoscope, listening to everything, it's child play. But now when you make up your mind, it's time to go this path, no matter what you find, it becomes a bit tricky. So after I did my Form 4, I got a B. And then, so at that time, before this parallel program started for medicine, it was either you have the cluster or you don't have the cluster.
Yeah.
So when we were going around campuses, this grade, you can become a lawyer, you can do biochemistry, you can do what? We refused all of them. Then eventually, the same place where she got to do her clinical medicine, I enrolled in the same university. Wow. The time before she did, because I enrolled there in 2009, and I did my diploma in clinical medicine. It's 3-year, 8-month program, which is basically like a diploma which you do for 8 years. After that, I enrolled for the degree in medicine at Kemu in Meru.
Wow.
So when I was in Meru, because you see, your life is also moving. You're not getting any younger. In the course of my second year, I got to meet my wife.
Beautiful.
In my 3rd year, we got married.
Congratulations.
In the 4th year, we had our baby.
Yeah.
We are still studying,
Yeah.
And this time,
Studying and still progressing on this other side.
we are balancing,
Yeah.
So this side we are studying, the other side you are at home.
Yeah.
The other side, when you get time to come home, mom consults you. How do you go around knowing this system? How do you go around knowing these conditions? And we encourage each other.
Yeah.
Because now you had a family, now you see when you get a family and you're the man of the family, you have to provide.
That's true.
So I got the opportunity to work at a hospital in Meru, Jordan Hospital, where I used to work in the night, and then you also study in the day. Then in the afternoon you get time for the family. So it was like you are on 24 hours. Because in the morning
program.
you enter class at around 7 a.m. The good thing, med classes, they are not very long. In the senior years of med class, they are not very long. Then you go to hospital, those hospital sessions. Then in the afternoon, you go meet your family. Then in the evening, you go for your night shift. Then the following day at 8 a.m., you're in class. So you have to balance. But that taught me a lot. It taught me, because the hospital where I went to work, it was a young hospital. Actually, I joined it when it was around 3 months old. So it was a fairly new business for the person. And during the course of my stay there, I got to learn the ropes. And this is where I remember the story of David, where when he was going to face Goliath, the issue was David remembered what he has done in his past. He's fought with bears, the lions, and all that. So even this time round, when you're coming to start this hospital, it's not something very new. Only that now it's a new at a different capacity. Because now you're the proprietor, you're head of operations.
That's true.
But at least you've had a taste from a previous experience. For my internship, I decided to go Prestige, where we joined Mater Hospital. The advantage is that Mater gives you a feel of state of the art medicine, where you have almost all your services within reach. ICU is there, dialysis is there, name it. These other rare tests, genetic testing is there, pathology is there, you do open heart surgery is there, you do brain surgery is there. So it was a chance to learn not just a comprehensive way of doing medicine, but also how to use some of the things that some facilities may lack. Okay, so when I was there, God is gracious, the same facility, they took me in after my internship. Because the same way you worked, I was working at night and schooling during the day. Internship is the same method. In Kikuyu, there's a saying, anasamanga umenye gai wake, because a young boy will do anything and God still protects that young guy. And I tell you for sure, there's also a God of interns. Medical interns, there is a God for interns. Because there you push close to 48-hour shift, one person, day and night. Then you have like a 6-hour break in between. Then you go back for another 36 to 48-hour shift. So the God who sees you through internship. I remember there's one professor who told me internship in med school is like is a modern day slavery for a doctor, because you work, and if you can be able to go through internship successfully, you can be able to practice successfully. So after the internship, Mater retained me, and then now there I was working in the outpatient department. And now this dream to start a medical center was busy cooking somewhere. It was busy cooking somewhere, it was cooking somewhere, it was still burning somewhere. So eventually when we had all our systems right, I left Mater Hospital to come and start off this medical center. We are currently at our young, a very tender age. Actually, as per today, we are 5 days old.
Wow.
And we being 5 days old, we've already seen quite some interesting things here, where people actually need service. We are the only hospital around this area that offers maternity services.
That's true.
So women are coming in for that service. I myself, during the course of my internship, I did a course in neonatology, a postgraduate diploma in neonatology with the University of Southampton. It was an online course. Yeah. So we now at least we have that, we're able to deal with the young babies. These are babies who are 28 days old and all the way to preterms. Yeah. So that's where we are at. We are a Life Friends Medical Center, located within Satellite, opposite the police station off Kabiria Road. We are a 24-hour facility. We have a laboratory, we have ultrasound, we have the general consultation, we have inpatient, outpatient, and also an operating theater. Yes.
Wow. I consider it a great blessing to the community, especially to have doctors who are qualified near, and also a Life Friends Medical Center, which is now within reach. We pray may the Lord God bless it and continue to raise it up. Now, as people, I know they will, thank you because you told us now it is new. As people now begin to know it and even begin to come, what maybe would be the expectation of the people as they come? Ma'am, as a medical officer, you can tell us.
Our facility, we have our doctors around 24 hours.
24 hours.
And even if you come and we feel like we need to refer you, we have a connection with ambulance care, so we don't fear even if you come with an injury that we cannot be able to handle. And we have done that. The first day we had a case of a very severe injury, and within an hour the patient was received in Kenyatta. And we are grateful for the connections that we have at this juncture. And also our maternity care, we are able to take care of that. Also, our lab is well taken care of. We are able to do hematology, that is tunapima damu, tunaona hiyo mambo ya full hem, hizo vitu zote tunafanya. We have biochemistry, so we are taking care of UECs. We also do hormones levels, like thyroid we are doing, HbA1c, and whoever comes at this time, we have an offer for all the mothers
Beautiful.
who are pregnant mothers. We are doing consultation and ultrasound and also urinalysis. We are charging 1,000. But this is an offer that you learn for the first month.
That's true.
Later on, you come back to our normal charges. An ultrasound is 1,500. And also we have, because we have the consultation fee, as per now, we know it won't hurt anyone because we have cushioned everything. When you get into our facility, we have our reception, we have our team of nurses, we have good pharmacy and that good lab, and also surgical care. If it is a surgical issue, we have a team of doctors whom we are working with. And we are so happy to be accepted in Satellite, Kabiria, and to work with the people. And we are advising them, don't be afraid to come to us. We are here because God sent us to start this business, and we want to grow with everyone who is within the locality. Thank you.
Beautiful, beautiful. I know our viewers, you are hearing by yourself, and this is really beautiful and so impactful. Dr. George is approaching to wind up, and Dr. Hannah is talking about the expectation. Do you have something else you can say when people come, the cases you will be handling or you have handled, and the confidence and assurance you give to the people?
We are offering holistic healthcare service. There's something that I just want to reiterate is that there's a good number of people who are afraid to visit the hospital in the notion that they'll get this COVID-19 thing. The truth is that whatever medical condition you have is most likely to kill you faster than the COVID-19. The truth of the matter is that so far, these are not rumors, but so far Africans have been shown to be a little bit resilient. Although we are still studying this virus, they tend to be a little bit resilient towards the virus. Unless you have an underlying medical condition that is poorly controlled. Let's say, for example, you have hypertension. If your hypertension is poorly controlled and you get the virus, that's the time it knocks you down. If your hypertension is well controlled, your diabetes is well controlled. If you have HIV, it is well controlled. If you have your kidney, you have a heart problem, and whatever condition is if you have asthma, and it is well controlled. Even if you have to contract the virus, the chances of it becoming fatal is very minimal. People should seek healthcare services, not just within Life Friends Medical Center, because people have had this notion that going to hospital is not good, likely to contract the virus and all that. Whatever medical condition you have, seek healthcare advice. There are some funny rumors that are going around, and I want people to just come to the professionals and ask them for the right thing. The next thing is that, as I was saying earlier, we're offering holistic services. We may not have everything under our umbrella. However, we have links to everything that you need for your healthcare. Okay? We have inpatient, we have outpatient, we have a maternity, we have an operating theater, we have imaging, and whatever we don't have, we'll always link. Okay? We'll always link you to what health services you need. The key thing is what I need to repeat, and for our people to know, please, if you are unwell for whatever reason, seek healthcare service. I want to go back to the Bible because I'm a Christian. When Jesus Christ was on this earth, he performed miracles. He healed people. But there's something that I want you to look for in the book of John, because John brings it very well. Every time he healed someone, he told them, go and see the teachers of the law, go and see the Pharisees, go and see. So they confirm that indeed you are now well. Okay? So you'll come to us doctors, okay? We help you out, okay? So at the end of the day, if Jesus could tell people, go and see so and so to confirm that indeed you are now healed, why not come to hospital? People should come to hospital to get the correct treatment and diagnosis. Thank you.
Thank you, thank you, thank you. This is really beautiful, this is really wonderful, and this is a great blessing. I'm happy here today. This is a unique coverage, and where you have the mother is a clinical officer, qualified one, and the son is also a doctor, neurologist, and so many other areas. Now I'm thinking, what is becoming of the father and the other children?
Actually, let me just add on that. My dad has gone back to school.
Wow.
And very soon he'll be a lawyer.
Hey.
He's doing Form 4 2020.
He has gone to school at what age?
Don't worry about the age. It is just what a number.
Wow.
But 2020, Magoha is giving him the certificate of KCSE.
Hey.
Yes.
Hi, Ngumbaru.
And once again, Ngumbaru.
Thank you so much. Thank you so much. Thank you so
Karibu.
much. Maybe
Karibu.
as we wind up, maybe can have a parting shot. If there's something you want to say, I will give you maybe 30 seconds.
Thank you again. I want to tell everybody or everyone who is hearing this, please, if you have a dream, don't sleep over it. Don't cover it and you hide your head under the sand. Please make, even if it is small steps, but let them be progressive towards what you dream, because all dreams are valid. 2012, I did my Form 4. 2018, I graduated from a medical school. 2020, I'm opening a facility that will offer health care. Everybody's dream is valid. Thank you.
Beautiful. Dr. Jaya?
For me, I'll talk about the facility. We, as a Life Friends Medical Center, have one motto: your worries are our concern. Come, we sort out your worries, because they are our concern. Thank you.
Thank you so much. Thank you so much. And our viewer, I think I cannot add anything. You have heard by yourself. Maybe I would say visit this Life Friends Medical Center and see it by yourself. It's really beautiful. This is wonderful. It is your program, Humble Beginning, with the Bishop Dr. Ken. My story, my testimony. Thank you.
Humble beginnings. My story, my testimony.